Good evening, Dr. Phil here. Today we will be discussing on the brachial plexus anatomy. Anatomical knowledge of the brachial plexus is essential for performing regional anesthesia of the upper limb. A useful mnemonic is really tired, don't care now, which stands for roots, trunks, divisions, cords, and nerves. The brachial plexus is formed from the anterior primary rami of C5, C6, C7, C8, and T1. These roots emerge from between the anterior and posterior tubercles of the transverse processes of the cervical vertebra. These 5 roots merge in the posterior triangle of the neck and forms 3 trunks: the upper trunk from C5 and C6, the middle trunk from C7, and the lower trunk from C8 and T1. The roots' upper and middle trunks lie between the scalenus medius and scalenus anterior. Anatomical variation exists. The nerves are enclosed within a fascial compartment which consists of the posterior fascia of the anterior scalene and the anterior fascia of the middle scalene muscles. The long thoracic nerve originates from the anterior rami of the C5 to C7 roots, supplies the serratus anterior, which draws the scapula anteriorly against the chest wall, and when the scapula is fixed, it assists in respiration. The dorsal scapular nerve originates from the C5 root. It supplies the rhomboids, major and minor, and the levator scapulae. Rhomboid major adducts and internally rotates the scapula to depress the glenoid cavity and fix the scapula to the thoracic wall. Rhomboid minor adducts and internally rotates the scapula and aids in scapular elevation. Levator scapulae elevates the medial border of the scapula, and when the scapula is fixed, lateral flexion of the neck. The subclavian nerve, or the nerve to subclavius, originates from the C5 and C6 nerve roots and supplies the subclavius muscle, which depresses the clavicle and protects the brachial plexus and subclavian vessels from injury from a clavicle fracture. From the upper trunk emerges the suprascapular nerve, which supplies the supraspinatus and infraspinatus. The supraspinatus helps in abduction of the humerus and infraspinatus in external rotation of the humerus. The suprascapular nerve also provides sensory supply to the acromioclavicular joint and the glenohumeral joint. The 3 posterior divisions form the posterior cord, which lies posterior to the axillary artery and branches into the radial nerve, the axillary nerve, the thoracodorsal nerve, the upper subscapular nerve, and the lower subscapular nerve. The radial nerve supplies the elbow, wrist, and finger extensors and provides sensory supply to the dorsal aspect of the thumb, index, and middle fingers. The axillary nerve supplies the deltoid and teres minor. The deltoid anterior fibers is responsible for flexion, internal rotation, and abduction of the arm. Deltoid superior fibers are responsible for abduction of the arm, and the posterior fibers are responsible for extension and external rotation of the arm. The teres minor helps in external rotation and adduction of the humerus, and it stabilizes the shoulder joint. It holds the head of the humerus down against the upward pull of the deltoid during arm abduction. The axillary nerve provides sensory supply to the skin overlying the deltoid muscle. The thoracodorsal nerve supplies the latissimus dorsi, which helps in adduction, internal rotation, and extension of the shoulder joint. The upper subscapular nerve provides motor supply to the subscapularis, which internally rotates the humerus. The lower subscapular nerve provides motor supply to the subscapularis, which internally rotates the humerus, and the teres major, which rotates the shoulder medially and extends and adducts the shoulder. 2 anterior divisions of the upper and middle trunk forms the lateral cord, which branches into the median nerve, lateral head, and the musculocutaneous nerve, and the lateral pectoral nerve. The median nerve supplies the flexor compartment of the forearm, tena and intrinsic hand muscles. The median nerve is also responsible for sensory supply of the skin over the tena eminence, palmar aspect of the thumb, index and middle finger, and the radial half of the ring finger. The musculocutaneous nerve provides motor supply to the anterior compartment of the arm, coracobrachialis, biceps brachii and the brachialis, and sensory supply to the lateral cutaneous aspect of the forearm, shoulder and elbow joints. The lateral pectoral nerve provides motor supply to the pectoralis major and minor, and sensory supply from the pectoralis major. One anterior division of the lower trunk forms the medial cord, which branches into the ulnar nerve, median nerve, medial cutaneous nerve of the arm and the forearm, and medial pectoral nerve. The ulnar nerve provides motor supply to the flexor carpi ulnaris, flexor digitorum profundus, hypothenar muscles, third and fourth lumbricals, palmar and dorsal interossei, flexor pollicis brevis, deep head, adductor pollicis, palmaris brevis. The ulnar nerve provides sensory supply to the articular innervation of the elbow, wrist, carpal and phalangeal joints, and cutaneous innervation to the ulnar aspect of the hand, the fifth digit and the medial half of the fourth digit. The motor and sensory supply of the median nerve is as mentioned. The medial cutaneous nerve of the arm provides sensory supply to the skin of the medial side of the arm as far distal as the medial epicondyle of the humerus and the olecranon of the ulna. And the medial cutaneous nerve of the forearm supplies the skin of the ulnar side of the forearm as far as the wrist. The medial pectoral nerve provides motor supply to the pectoralis major and minor. Relationship of the brachial plexus with the subclavian artery. The subclavian artery arches over the first rib just posterior to the insertion of the anterior scalene to the first rib. Upper and middle trunk lies above the subclavian artery. The lower trunk lies posterior to the subclavian artery. The middle scalene muscle lies further posterior, which also inserts into the first rib. Relationship of the brachial plexus with the first rib. At the lateral border of the first rib, about the midpoint of the clavicle, the three trunks each divide into anterior and posterior divisions, and the ultrasound picture resembles a bunch of grapes sitting on the first rib. Relationship with the clavicle. The cords of the brachial plexus enter the infraclavicular region lateral to the axillary artery at the midpoint of the clavicle. Relationship of the brachial plexus with the axillary artery. The cords are enclosed within a sheath together with the axillary vein and the artery, with respect to their orientation to the second part of the axillary artery behind the pectoralis minor. The cords are named lateral, medial, and posterior. The cords give off their terminal branches below the pectoralis minor. The terminal branches maintain the same relation to the artery as the cords. In the most common arrangement in relation to the artery, the musculocutaneous nerve is superior and posterior, median nerve is superior and anterior, ulnar nerve is inferior and anterior, radial nerve is inferior and posterior, and inter-individual variability exists. The musculocutaneous nerve leaves the brachial plexus early, and at the level of the axilla, it is located in the coracobrachialis muscle. The median, ulnar, and radial nerves are enclosed together with the axillary artery within a connective tissue sheath derived from the prevertebral fascia. Local anesthetic spread occurs better longitudinally rather than circumferentially. The nerves are grouped closest together at the proximal edge of the axilla and the lateral edge of the pectoralis minor. The nerve steadily diverges from the axillary artery as they run distally. This table shows the nerves and the muscles that they supply, and their nerve roots and cord origins. These two diagrams shows the cutaneous innervation of the upper limb. The radial, median, and ulnar nerve will be discussed in a subsequent video. These are my references. Thank you.